Menopause occurs at an average age of 51, when the last natural period has happened. Some women have no symptoms at all, but most do have a combination of hot flushes, vaginal dryness, difficulties with concentration and memory, and indeed many others. The way of treating this is the first instance to increase your exercise, decrease weight, and if you have severe hot flushes, decrease the amount of caffeine and alcohol that you consume, and this can be to quite some benefit. However, the symptoms occur because your estrogen levels have dropped, and the best way to treat the symptoms is to take HRT, which is a combination of estrogen and progestogen. Some, however, cannot take HRT or would not wish to, and there are pharmacological alternatives that pick off certain symptoms. So venlafaxine, for example, is used to treat hot flushes. There are alternative therapies, and red leaf clover and black cohosh are two of the most popular and have been shown to have some effect on menopausal symptoms. It can be seen, therefore, that there are very many approaches towards treating menopausal symptoms, and it is important that each woman is treated as an individual and a package made that suits her best.